My name's Beatrice, and I'm here with my partner Elmer, and we're going to talk about the dark side of zinc and what you need to know about it. So, zinc is a mineral that is involved in cellular metabolism, and it enhances our immune function as well as it's good for wound healing, protein and DNA synthesis, especially during the development years. It's found in natural fruits and can be found in supplements. Zinc is the second most abundant essential trace mineral in the body. And would we, as dietitians, recommend zinc supplementation to our patients? The answer is no, and we'll explain it.
Evidence against zinc supplementation for immune support pertaining specifically to COVID-19 is presented in a case study series by Elan Jian et al. In this case study series, all three participants had no prior history of hypoglycemia or other adverse health conditions, and were following a high-dose zinc supplementation regimen of up to 250 milligrams a day. All three patients had adverse complications that led to a steep drop in glucose levels. All three patients were not given clear instructions on how to or when to stop supplementation, with one patient experiencing a severely low glucose level of 26 grams over deciliters. These three case studies raise the concerns about the risk of zinc supplementation and the importance of monitoring its use. While zinc is essential for several physiological processes, zinc in high amounts can impact carbohydrate metabolism by increasing enzymes that promote and accelerate glycolysis and gluconeogenesis. Research also shows that zinc reduces glucose absorption in the intestines while decreasing glucose synthesis in the liver.
So, zinc intake and the status in the United States. So, the majority of the US population actually exceeds the adequate amount of zinc throughout their diet. So, this is why zinc wouldn't, supplementation wouldn't be recommended.
Furthermore, zinc supplementation has to be closely monitored since zinc at large doses is toxic. Signs of zinc toxicity include nausea, dizziness, headaches, gastrointestinal distress. If an individual takes too much zinc for a prolonged period of time, they can experience severe issues such as lower immunity, low levels of high density lipoprotein, cholesterol, and neuronal death.
So one of the things that zinc causes is cytoplasmic anemia, and this is caused by zinc-induced copper deficiency. So cytoplasmic anemia is characterized by granulocytopenia, ringed cytoblast in the bone marrow, and zinc impairs the absorption of copper in the GI tract. So an excess level of zinc consumption stimulate the metallothionein with a stronger link to copper, and this results in a decreased absorption of zinc. So in a case study here with a 74-year-old Caucasian female, she was taking over-the-counter vitamins and mineral supplementation, as well as Preserve Vision twice daily, which has 40 milligrams of zinc and 1 milligram of copper. So we can see here that her lab results within the month of May 4th, they showed poor hemoglobin, white cell count, as well as neutrophils. And when the doctor told her to discontinue the supplements, she was transfused with 2 units of red blood cells to improve hemoglobin. And the doctor also initiated oral supplementation of copper, 2 milligrams a day, and her blood levels significantly increased within a 2-month period.
In a randomized, double-blind, placebo-controlled clinical trial, researchers assessed the effectiveness of zinc and vitamin A supplementation in infants and young children suffering from severe acute lower respiratory infection, also known as ALRI. In the zinc supplementation group, 39 participants received zinc, and the study revealed that boys experienced greater benefits than girls, with shorter fever duration and symptoms. The recovery rate for boys who received zinc was 2.6 times higher. However, since similar results were not observed in girls, it limits the generalization of the findings regarding the benefits of zinc supplementation. The article also notes that other trials and meta-analysis have reported mixed results about zinc supplementation. Therefore, this highlights that further research is needed to confirm zinc's role in boosting the immune system. Thank
Thank
you.
you.